Well, I am here at Cira World in Orlando, Florida. This is an amazing event put on by Dentistry Sirona, and I'm here with a good friend of mine, Mike Skramstad. Mike?
Nice to see you.
Or Scrammy, as some people like to call you.
Yep.
And Mike, this is going to be an interesting discussion here because typically when I'm talking to a CEREC dentist, they've been in practice for a number of years, a lot of years, and we're doing it the old-fashioned way and changed over to CEREC. But you are a recent, when I say recent, or newer graduate, and had the opportunity to dive right into this immediately. So tell me about that, just the initial thoughts of this whole thing.
Yeah, so I graduated dental school in 2000, so 16 years ago, so it goes by fast.
Yeah.
So I don't consider myself a new dentist anymore, but
I do.
I bought, I still remember it, 2003, so 13 years ago I bought my first CEREC, and I was just one of those guys that went to a local meeting, and I thought it was fascinating, and truth be told, I was as young as I look now at 42. Imagine how young I looked at 27. So I was really looking for a way to distinguish myself and get something new and different, and so that's kind of how I fell into it. I couldn't afford it, but I managed to figure out how to afford it, and that's kind of where it started out.
And that's a truth. That's an important statement that people get sticker shock and they go, well, I'm not going to spend that kind of money, and all of a sudden you realize what it's done. So let's talk about that for a second. You can't afford it. Explain that. I mean, I'll give you the simplest story I can say is what is one visit dentistry all about? Yeah,
and I think that I always thought that ROI, the way that the salespeople sell it, is a little bit off. You know, they tend to concentrate more on the financial aspect of it, which is obviously important. You need to be able to financially afford it. But what I found is what the cost wasn't really. It turned out not to be a big deal. Of course, you're nervous about it. It's a big number they put in front of you. But in the end, after 13 years, I can tell you the biggest financial gain is obviously from your patients, and being able to deliver the restoration to a single appointment is by far the biggest ROI or return on investment you'll ever have. So my practice from 2003 to 2016 is exploded, and it's you only can kind of correlate it from the technology.
And your patients just expect this now. They expect the technology. They expect the 3D, the one-day dentistry. They don't know anything else.
No, I mean...
So when you get a new patient comes into your office and says, I need a crown, you go, okay, we'll do it tomorrow when you're done. When do I come back?
Yeah, I used to make a bigger deal of that. I'd have the patient put the block in the mill, and we used to make a big deal. But I think you almost get complacent in a sense because I'm so used to doing it, my patients are so used to expecting it. So when you get a new patient that needs a crown, and you forget that for most of the population, this is still like new, amazing technology. So they're pretty amazed by it still.
So coming in early in the early 2000s, how did you learn how to use the machine above and beyond what the trainer taught you?
Yeah, it was a much different time back then. We were kind of out in an island, so to speak, on our own. So I think in some senses that helped me as an educator now, because back then we just had to brute force, just sit on the machine and just learn it by repetition and try to find all the hidden things that the software engineers would put in there.
But you must have gotten to a certain point where you could help your other peers.
Yeah, I mean, I was just obsessed with it. I mean, you can talk to my wife. She'll tell you. I would be there on the weekends and at nights and just working on it. But obviously, it's much different now.
So how's the education evolved now?
Well, now that there's a very fixed organization to the training. So Patterson Dental does a very nice job. So when you buy the machine, they now have a path, like an immediate path of where you go. You might go to an accept program, you might go to basic training. Our website, cerecdoctors.com, everybody gets a year free of that. And so it's and the biggest thing I think now is there's such a huge community of CEREC owners that if you ever have a question, there's discussion forums, and you can get an answer within minutes.
And is that the actual website's name?
cerecdoctors.com. Yep.
Now, is there some affiliation with Frank Spear in this whole thing?
So we're the parent company of where we're at is Spear Education. So cerecdoctors.com is a subsidiary of the parent company of Spear. So we've merged companies, but we're still kind of a separate in the eyes of most people.
But in terms of designing crowns and designing form and designing occlusion, your philosophy is based back on Spear's precepts, or no?
Yeah, it very much so is. So we kind of, the way that I always look at it is Frank Spear and the Spear Education Company is really good at teaching you kind of the why. Why would you do something? Why do you need to have a certain occlusion? Why the front 6 teeth are important? Where CEREC is more the execution of how you do it. That's kind of the way I always looked at it.
So the
foundation first.
Treatment planning. and how to implement
Yes.
it with the CEREC itself.
And what the great thing is about having the companies merge like that is you have people that may have never thought of, they go in the opposite direction. They start with CEREC, but then they realize there's so much more for me to learn that I never even thought with occlusion and treatment planning. And so we find a lot of people from CEREC going into SPEAR and then vice versa. A lot of people from SPEAR, a surprising amount, have CEREC, and so they're kind of learning the opposite.
Now, one of the things that you've seen evolve, and I'm leading you on to something, as you know, is that if you had to do lower second molars, upper second molars way back with the materials that were there, you'd go, you kind of grit your teeth. But at this point, I think there's something new that's out there. I'll let you describe it.
Yeah, it's kind of going back in the early 2000s, we were very limited on the materials that we had. We were putting a lot of Vita, Feldspathic, and Empress, and we would put them on second molars, and it didn't turn out very well for us long term. We'd have a lot of breakages. So, fast forward to Emax, that kind of was a wonderful material. It changed all our outcomes on molars. But still, with glass ceramics, you have to bond it. You need a certain amount of reduction, which can be hard.
Right, if you want to get 2 millimeters.
Yeah, and so obviously we know that Sirona introduced a way to do chairside zirconia this February of 2016, so things have changed a lot. I never really envisioned myself using a lot of zirconia, but now on all second molars, that's all I do is zirconia.
And the beauty of zirconia, and I'll ask you, I'm not sure, but I assume you can do less tooth reduction also.
Correct. Yeah, there's not really a defined preparation design. You could prep, if you want to prep a chamfer or even a knife edge, you could do that. But the biggest thing is obviously the less tooth reduction. So where with a ceramic you might need 1.5 millimeters of final thickness of your ceramic, with zirconia we can go down to like 0.7. So it's almost half the amount of reduction that you really would need with a glass ceramic.
And it's certainly more durable. But so when you actually tell me a little bit about the zirconia process. So do you just stick a zirconia block in your old mill, or is there something else you have to do?
Well, there's a couple different milling options that Sirona has. The traditional milling units that have been around forever, it's more, we say milling, but it's technically a grinding process where diamonds grind with friction, they grind it wet. So you still can use that with zirconia, or the new process Sirona came out with this year was the dry milling. So actually milling in a dry environment. And the difference between the two is just basically time. So if you have a zirconia milled dry, then you can put it in the sintering furnace, and it's about 50% faster in the sintering process. Whereas if you grind it wet, you have to undergo a drying process before sintering.
Oh, so how long is it in the fast set? In the fast system, how long is that? Just
anywhere from 13 to 17 minutes. So it's still, by industry standards, it's really incredibly fast. But even if it's wet, a lot of the existing owners you're talking 25 minutes, which is still ridiculously fast.
Can you do let's say 3-unit bridges with the zirconia?
Yeah, up to 40 millimeters.
So it's based on the oven. Based
on the width. So usually most 3-unit bridges, even including a molar, can fit in a 40 millimeter block. So
you have to change the design at all with the connectors or anything?
The software actually tells you. So if your connector dimension is not adequate with zirconia or Emax for that matter, it will give you a big exclamation point in the software. So noticing like you have a problem, you need to fix it before you mill it.
They didn't have that in the old days.
No.
So the evolution's been remarkable.
Yeah.
So usually I say to someone who's a CEREC owner, has it changed your practice? It really hasn't changed your practice. It's just made your practice more of what it is.
I mean, in some senses, it probably will change my practice looking forward because my outcomes will probably be better and longer lasting on second molars. So nobody likes to redo their dental work, and being a very early CEREC adopter, I have redone a lot of work that was my own fault for putting the wrong material in the wrong place.
You didn't have the right training. You didn't have
CEREC
doctors
yes,
to go to.
I did. So now changing the outcome will change the practice, and yeah, so it's been great.
Boy, it's just, I've been in practice a little bit longer than you have, and people say to me, well, isn't it time to retire? And I talk to you and some other people, and it's just like, what's going to happen tomorrow? What's the new thing I'm going to have in the office tomorrow? What's that new box that comes in? And the rest of the stuff goes, oh no, Dr. Skramstad has another box of new stuff. What are we going to do now?
Oh yeah, she should talk to my staff. Every time I get a new box, it's like, well, now what are we in for?
Now, how does the staff get trained in this whole process also, just real quickly?
I basically train them all. So depending on the office, every office allocates different things to their staff. My office, with the CEREC specifically, I like to image, I like to design.
I see.
They can certainly do that, and some offices do that, but I like to do that myself just because I like it.
Well, one thing they don't have to do is they don't have to make temps.
No, but they are very good at. They will they mill, they polish, they stain and glaze.
That's
They
great.
prepare it for bonding, so they are quite involved in the process.
Mike, you know what? You're a pleasure.
All right.
Well,
Thanks
glad
a
to
lot,
know
Paul.
you.
All
Really
right.
glad to know you.
Thank you.
Good luck with everything.
Thank you.
And I hope I'm in practice when you're finishing your practice. I hope I'm still around to talk to you. Thanks very
Let's hope
much.
so.
Well, again, from Orlando, Florida, and Cira World, thanks very much.